Almost everyone who suffers from high blood pressure knows that exercise can help. However, one type of training is particularly effective in lowering blood pressure. It can drop your blood pressure nearly twice as much as using regular medication in just 15 minutes a day. In this video, we will share some amazing workouts for people who have high blood pressure problems. So keep watching this video till the end. If you really want to get the full benefit for your health, welcome, a safe and therapeutic place for patients and caregivers of all ages. Before we dive into the 6 workouts to reduce blood pressure, make sure to subscribe to the channel and give thumbs up to this video. Let's get started with our topic. Hypertension is described as a continuous and sustained increase in blood pressure. It is necessary to define it. To understand it properly, when the heart exerts tension on the arteries, the blood is directed to various human body organs. This action is called arterial pressure. The highest pressure, also known as systolic pressure, is produced by each contraction. Conversely, each relaxation simultaneously establishes a minimal pressure or a diastolic pressure. High blood pressure is very dangerous for your health. It can cause heart stroke because of arteries blockage. So guys, nobody can compromise on health. Regular exercise is one of the most effective ways to prevent high blood pressure. Moderate exercise can be done 3 or 4 times per week by people with high blood pressure who do not have heart failure, for example. One option is to run at a good pace for 20 to 24 minutes at a time. Patients with hypertension certainly benefit from rhythmic and aerobic workouts involving different muscles such as walking, dancing, jogging, swimming, and biking. Let's look at a few of them and their specific benefits. But first, let's talk about how much exercise is enough for anyone. Controlling high blood pressure with aerobic activity can be quite successful. However, flexibility and strength training, such as lifting weights, are also key components of a comprehensive fitness program. You don't have to spend hours every day at the gym to reap the benefits of aerobic exercise. However, it will also help to incorporate modest physical activity into your everyday routine. Consider these 6 workouts to help you attain your weight loss goal while also lowering your blood pressure. Number 1 is walking 10 minutes of brisk or moderate walking 3 times a day. Exercise reduces blood vessel stiffness, allowing blood to flow more freely, which reduces blood pressure. Exercise has the most visible impact during and immediately after a workout. Lowering blood pressure is most apparent, especially following a workout. As a result, breaking up your workout into many sessions throughout the day could be the best method to battle high blood pressure. In fact, 310-minute walks every day are more effective than 130-minute trek in preventing future blood pressure increases. Number 2 is swimming. This exercise can also help regulate blood pressure in persons aged 60 and up. Swimmers gradually increase their time in the pool over 12 weeks, eventually reaching 45 minutes of continuous swimming. As a result, the swimmer's systolic blood pressure had dropped by an average of 9 points by the end of the use it or lose it theory. Stands true because the advantages of exercise are not achieved if the exercise is not continued. According to this belief, our mental abilities will deteriorate if we don't keep our brain active, especially as we become older. Conversely, we can delay the inevitable arterial rotation that occurs with aging if we keep our minds active. So that's the way you can lose gains after stopping exercise for 2 weeks. The standard recommendation is a moderate exercise, 450 minutes per week, or vigorous exercise for 75 minutes per week. Number 3 is dancing. This activity is a good complement to therapy that can help you lower your blood pressure. It strengthens the cardiovascular system and decreases cholesterol, all levels. Furthermore, it reduces tension, which is one factor that leads to high blood pressure. Number 4 is weight training. Although it sounds counterintuitive, weight training or lifting can reduce blood pressure. In addition, strength training actually raises blood pressure levels temporarily, but can help overall fitness, improving blood pressure levels. Alright guys, I hope you're enjoying this video, so please leave a like and subscribe to the channel Scope. Care to watch more evergreen content in the future? Let us know if you have any further queries in the comments section below. Now we are moving towards our next spot on our list, which is also good to go. Number 5 is ride a bike. Parker says that a morning bike ride is a big part of his routine, and one that he emphasizes with his clients. A simple 30 to 35-minute bike ride may get your heart pounding, get you outside, and help you improve your cardiovascular health while having fun. People with hypertension can benefit from fitness routines that combine aerobic exercise, such as riding, with resistance training, such as lifting weights. In 2016, the American Heart Association highlighted 2 different studies that looked at the impact of riding on heart health and were published at the same time. One of the studies, published in the journal Circulation, looked at 45,000 Danish adults aged 50 to 65 who bike for both enjoyment and commuting as part of their daily routines. The researchers have found that cyclists had 11 to 18 fewer heart attacks than people who had never ridden a bike for enjoyment or commuting. After 20 years of follow-up, the second study, published in the Journal of the American Heart Association, found that 20,000 Swedish adults in their 40s to 60s who biked to work had lower rates of obesity, high cholesterol, prediabetes, and high blood pressure than those who did not bike. These are all big risk factors for heart disease, of course. So over the course of 10 years, the participants' riding habits, cholesterol levels, weight fluctuations, blood pressure, and blood glucose levels were all tracked when compared to people that did not bike. These people were reported to be 15 less likely to be obese, 13 less likely to have high blood pressure, 15 less likely to have high cholesterol, and 12 less likely to have high cholesterol, and 12 less likely to have prediabetes or diabetes at the start of the study. People who continued to bike or started bicycling during the trial had a 39 lower chance of obesity and 11 lower risk of high blood pressure, an 18th lower risk of diabetes, and a 20th lower risk of diabetes, and a 20th lower risk of having high cholesterol at the end of the study. So guys, bike riding is an ideal form of resistance training. It strengthens the cardiovascular system, metabolism, and immune system. It also tones the muscles in the legs and back without putting too much stress on the joints. Arterial pressure rises at the start of this activity, though it can start falling to a lower level. Lastly, go to the gym. If you're looking for fitness options, the gym is a perfect place to go. Most of them have a mix of cardio and strength training machines that you can adapt to your skill level. Do a mixture of the upper body, lower body, and core exercises to maximize your blood circulation and the number of muscles you are working out. For people who are in their 50s and up, a safe practice is a peripheral heart action system. It alternates lower body and upper body movements as well as core workouts. This approach helps in the treatment of high blood pressure by allowing blood to flow to various parts of the body, preventing localization at the same time. You may build a safe circuit-style workout, which has been shown to be effective for fat reduction and blood sugar control. Older adults searching for a safe workout should avoid long periods of time in the prone position. This means you shouldn't spend too much time on your bag, such as when doing a bench. Press alternate positions during your workouts to avoid blood clotting and the risk of lightheadedness from a sudden change in position. However, people should talk to their physicians about how best to control their blood pressure and which workouts are safe to practice. You might be concerned about taking medication to lower your blood pressure. If you have been diagnosed with it to treat your high blood pressure, you must change your lifestyle. You might be able to avoid delay or lessen the need for medication if you successfully regulate your blood pressure. With a healthy lifestyle, we always emphasize three things. Stay hydrated, eat more greens, and move around each day. You have seen the 6 best workouts to which you can manage your blood pressure and keep it down. This brings us to the end of today's video. I hope you found the content to be both informative and satisfying overall. The consequences and pain of high blood pressure reduces after choosing a healthy lifestyle that combines physical exercise with a proper diet. Nevertheless, you should always speak with a doctor before making any health-related decisions. Do you have any questions regarding your health? Let us know in the comments section. Don't put your health on the back burner. By subscribing, you will receive more exciting information and updates on healthy living. Thank you for taking the time to watch this video. We look forward to seeing you in the future. Video Keep Yourself Healthy and Cool. Bye.